could we start off by just maybe if you introduce yourself, Tamsin?
So I'm a standard conventional medical doctor trained at King's College, Guy's St Thomas's Hospital in London. I then did a postgraduate qualification after my general medical training in psychiatry, because I thought that it was an opportunity to get the root cause of everything, and actually was sold this biopsychosocial model, which is this holistic paradigm of care that really wasn't the case in psychiatry. But I enjoyed my time, and I learned a lot from those years. But then I sort of diverted off course because I was an amateur triathlete and got fascinated in that world, and then got quite good at it and got the opportunity to become an elite. So took a sabbatical from work for a couple of years, and then immersion in that world of performance sport and endurance sport, human potential possibility, and then looking at optimal health. So I trained or did a series of modules in functional medicine, which is much more popular in the States than it is here. And basically went on that course, really. And now I run so I did go back to the NHS after having my daughter, practicing in psychiatry, but I left around 5 years ago, and I run a private practice called Variability, which is based in London, but I actually have quite a global healthcare base, client base, sorry. So yeah, that's a bit of a snapshot.
Could you just describe what functional medicine is for those of us who aren't familiar with it?
So I think it's interesting now because more and more people are seeking out functional medicine. But really what it is a root cause analysis or approach to health. So rather than sticking a plaster over the top of whatever symptoms you have, it's investigating the different systems that may be involved in driving that dysfunction, which then appears as disease. So it could be, a series of blood tests. It could be looking at your gut health. It could be, urinary testing, looking at different heavy metals or mycotoxins, for example, which are mold toxins. So yeah, it's essentially building a picture of you, and it also takes into account the, behavioral drivers and underlying psychology and emotional health too.
Which I think is all particularly relevant for looking at treating and managing long COVID.
Yes, so exactly.
Could you then sort of, because obviously you've been suffering, protracted symptoms as well. Can you tell us a little bit about your initial experience, and then how, your long COVID experience then developed from there, and what stage of recovery you may or may not be at now?
Sure. So it was early March last year, and it could have been a number of things. I think it was around Chinese New Year, and my au pair went to the Chinese New Year, came back, had a bit of a swollen throat, felt a bit unwell. Then my daughter, who was then 5, developed like a red face and a cough and a temperature, but nothing that was out of that she hadn't had before. She was still up and about. And then she kissed me on the lips and coughed down into my mouth as she left to go with her dad.
Maximum viral load. Brilliant.
Yeah, I mean, and you just know, and this was before COVID was, a thing. This is like 6th of March or something last year, and we were still, it was a thing that everyone else got. And I just remember thinking that wasn't good. Like, that was not good. And you're used to getting spat and snotted all over when you have youngsters. But anyway, so the next day I developed abdominal pain and diarrhea. I felt really sweaty. I was like agitated. I remember going out for a walk and my armpits were dripping. And I took a blood test because I'm really interested, and I do a lot of self-quantification all the time. And I thought, right, I'm just going to send my blood to the lab and see if I'm ovulating, as you do. And then it came back, and it was with, I've done hundreds of blood tests before, and I could see the markers had shifted. So my white cell count was really low. My CRP was way high, which is an inflammatory marker of infection and inflammation. My lymphocyte count was low, which I've never had before, which is a marker of viral infection. And I went, holy crap. And no one could get tests at that point in time.
Yeah.
It was it wasn't until I think it was something like the 20th of March when I finally, as a private doctor, managed to get a private test, paid like 350 quid for it. And I was still positive at that time on a PCR test, which was quite interesting.
A long time. Yeah, you're not supposed to be. I know, like the virologists in hospitals were saying, no, you can't possibly still have the virus after 10 days. This is back in last March. But the number of, PCR tests that were coming back weeks in positive is remarkable.
Yeah, exactly. And I guess it is a part and parcel of that viral load. In retrospect, that week leading into my symptoms, I had about 6 different people who subsequently were known to have had COVID. So, these were people coming back from skiing in wherever in Europe, etc. So, I was exposed. So I had a high viral load. And at day, I think it was day 7 or 8, I had what we didn't know then, and I didn't know then. And it was fairly, frankly, quite terrifying, even as a doctor, because no one knew what to do with me. And you know this experience yourself. I had the cytokine storm. So I had this horrendous, sort of like childbirth pain around my pelvis and my hip flexors. Just a lot of pain. I remember thinking I wanted to get in a bath and have a bath. But anyway, so I was medicated with that, with codeine. And at that time I was, had been given all sorts of things by a private doctor, azithromycin, hydroxychloroquine, which made me feel terrible because it dropped my blood glucose. Awful feeling, worsened my tinnitus that I was also getting. Yeah, so I just went up and down. And then I remember at about 2.5 weeks, as we spoke about, I thought, I feel a bit better today. And I went for a sort of long walk with a few jogging bits in it. And I got back and I had this piercing pain in my lung and piercing pain in my balls of my feet. And then I was just back. I was set back. But really, the course has been highly fluctuating since. There were, the initial 10 days were touch and go. I could have been in hospital. Paul Glenn, who I've subsequently has been my physician, said, if I was in London, I would have been hospitalized then. But the only metric they were looking at was, blood oxygen levels. And my blood oxygen levels, having been a prior athlete at rest, were always quite normal. But if you exercise people, because we compensate well. My hemoglobin, which is a marker of red cells, so how many red cells you have, it was essentially like I'd been altitude training for 3 months. My blood became super thick, which is interesting. So, it's like you're knocked for 6 by this thing, and it kind of makes you sit up and go, holy moly, what are we dealing with here? How is this impacting all these pathways in the body to give this, this syndrome? And I was talking up about this in, after 2 weeks or 2.5 weeks, I went back on Instagram and I said, look, I've got this post-COVID. Is it long haul? What is it? And got so much, feedback because there were so many people suffering similarly and we didn't know what it was. So it's been a learning journey like it has for you. And now we're just trying to help more people with, with what we're doing here, with access to, giving more people information.
So, like, for the bulk of the last year, what are the symptoms that have been giving you the most trouble?
Probably sort of joint aches and recurrent chest tightness. So joints, sort of like this heavy muscle feeling, like you're walking on sticks, like they kind of feel a bit broken. That's how I feel in my legs. And you have, like I said, I was an athlete, like you, so was fit, physically fit, although I can probably tell you there was some immunocompromise going into catching COVID, which we'll come to. So that also I've had the whole gamut. I've had the palpitations, I've had the double pneumonia with, it took me 3 months to get a CT scan privately, and that showed widespread pneumonitis, which is inflammation of the lungs. So that's insomnia, anxiety, some related PTSD symptoms, dysautonomia, POTS, which has improved a lot now since antihistamine therapy and lots of salt, histamine intolerance. Bag
of fun, isn't it? Yeah.
Your body doesn't feel like your age. It's almost like reclaiming your body. You look in the mirror and you're like, that's not really me, as it were. And it's whether, and that's why it feels like the virus is still there. Do you know what I mean? It doesn't feel post-COVID at all. It feels like there's some bumbling along. We just don't have evidence of that yet.
Well, quite.
No.
And the funny thing is, it's like, you know, I sort of say, oh, God, I feel like a 70-year-old or an 80-year-old. And then I realize my dad's 80. And right now, like, he's in way better shape than me. If it was a question of who could, like, you know, run across the garden fastest, he'd smash me. You know, it's, that's kind of just how brutal it is. You know, he can sit down at his desk and do a day's work. I can't. So sort of moving on, before we sort of talk about some of the management and therapies and stuff, and then I'll start to invite some questions. I was speaking to Danny Altman actually yesterday, and we were talking about what the current thinking is in terms of what's actually going on with long COVID, right? Fundamentally, what's causing this problem? And there's it seems like there's 4 hypotheses, and inside each of those hypotheses exist other hypotheses too. But the first one is that we've essentially got a hyperactive immune system that got switched on by the initial infection. The initial infection is now gone, but we remain in a state of inflammatory, you know, hyperimmune response. The second theory is that there is still some viral debris somewhere kicking around in the body, and that is triggering this sort of inflammatory immune response. The third is that there is still active virus in an immune privileged site, wherever that might be. And the first sort of place we're looking at and pointing the finger is probably the small intestine, but there may be other places too. And the fourth is, as Danny put it, full-blown autoimmunity. And this would be bad. This would be really bad, I think. And so we have to sort of hope that it's not that, although there is some evidence that COVID has caused some autoimmunity in some cases. There have been some studies from the States which have shown that. So those are sort of the I guess the big questions we're looking to try and answer. And what the way I sort of look at it from there is we've got each of those is sort of creating a number of different sort of symptom generators, if you see what I mean. And this puzzle then, in terms of what's driving our symptoms, will help us understand what we might be able to do to help those symptoms. Although until we fix the root cause of the problem, then we are still kind of, just sticking a plaster on it. And so inside this puzzle, we've got pieces like, mast cell activation. We've got pieces like dysautonomia. We've got pieces like NAD plus deficiency. We've got pieces like current organ inflammation and damage. And for every individual person, these pieces may be differently arranged and differently sized, which is why it has such a heterogeneous presentation. And I think this is why when it comes to treatments as well, we get a lot of people saying, I ate custard tarts in a day and I'm cured, or whatever. There's a lot of people who maybe do whatever it is that they do that suddenly, sorts them out. And that's partly because we've got this really complex mechanism that we don't fully understand underneath it. So moving on to then some of the treatments which I've sort of trailed that we would talk about. So let's start with sort of breath work and yoga. And it strikes me that this is more sort of looking at helping the dysautonomia side of things. Could you just sort of talk a little bit about how that can help, Tamsin?
Yes, sure. I think I've become much more of a devout yogi than ever during this time, and meditator, or attempting meditator. But you're right. I think dysautonomia, I mean, what is it? All it means is a malfunctioning, as it were, of the autonomic nervous system. So this kind of balance between the sympathetic nervous system and the parasympathetic. So the fight or flight versus the rest and digest. You've been through this before. So why does this virus, why is it so terrifying to the body that it puts you into a sympathetic state persistently in some people? Now, even the people that have recovered that I've spoken to, some people who are quite self-aware, self-engaged, note that this is, and I'm not woo as a doctor at all, but it has a sort of energetically dark nature to it, in that, and so I don't know why that is, but I do know that, having experienced the sympathetic drive from this virus, I know that it can be disabling. So it's almost like the body needs to then be rewired, as it were, sort of like a soft reset out of this state, which is one of hypervigilance of your nervous system. So everything's then perceived as a threat, known as triggers. You know them well. So small triggers can kind of set off this sympathetic nervous system response, which then causes or exacerbates symptoms. So why the virus triggers that in the first place is unknown, but it seems to be much more common in people who are more prone to, or have a history of anxiety or PTSD or depression or trauma of any description. It also tends to be more common in people who have the cytokine storm or a version of it, which is when the body releases a ton of inflammatory mediators, which then trigger off this, and I think this is quite a nice term to describe the virus generally in how it can persist in long COVID is, or its ghost can persist, whatever which way we come to realize it as, this cell danger response. So I think that's what we get stuck in to some degree. And I think that's what, now I know I've gone off track from yoga and breath work, but I will get there. The body is, and the system is stuck in the cell danger response. And we need to move it much more back to a sense of physiological and psychological safety. I don't know if this resonates with you, but I felt very unsafe during my time with COVID. It helped that I was in nature. I was in Devon. I was away from all the drama. I tried not to watch the news. But, we were all pretty terrified to some degree with all the fake news, everything. And I think that compounded a lot of our reactions to the virus in terms of this sympathetic flooding, this adrenaline, cortisol, all these stress hormones. So yoga has been known for centuries to really help, with modifying the breath, with activating the vagus nerve, which is a massive part of your parasympathetic nervous system, through the work on breathing, through diaphragmatic stimulation, your diaphragm, working your diaphragm, getting you to quieten the mind, moving the lymphatic system, etc. So that's why it's become so popularized, really, because people in this world of, even pre-COVID, we were going slightly mental with our lacking grounding, and yoga can be very grounding. So I think that's one of the ways that it can help with long COVID, unless you do what I did and do, Ashtanga yoga and try and get your heart rate up at far too early on, and then do it in the sauna as well and worsen everything.
I was about to say, which types of yoga do you? I mean, obviously you don't want to be doing level 3 vinyasa. What kind of yoga would you recommend?
I mean, it's more flow, restorative, calming yoga, but I'm trying to remember the name, and also the Kundalini breath, which we'll come to, but it's more restorative yoga. But yoga is personal, to be honest. I think you have to really resonate with the teacher. I had a couple, I really like Tara Stiles, who has a YouTube channel. She's very, lovely and hippie and calming. And also Peloton have an app that's like 10 quid a month with a whole load of yoga on it. And they've got great music, do it whenever. And I really resonated with one of their instructors called Dennis Norton, if you want to look him up, because he's like, super sorted, super grounded. He always comes out with these quotes like, "We're practicing developing serenity under duress." So that always resonated.
Yes, indeed.
Yeah. So how it's multiple work. It works on so many levels. So do you want to go on, and I'll talk about that after. Go on.
Yeah. So my experience of this is about 4 days old. I started at the start of the week in terms of breath work, and it's partly because I was having these waves of fatigue, which were coming at me multiple times a day. It sounds like there's something very exciting happening at your end, Tamsin. Does it?
Sorry, it's actually. Yes, sorry. Can you hear that? Sorry, I'll put him down.
No, it's hilarious. It sounded like I'm wearing headphones. It sounded like I had a dog basically licking my ears. It was brilliant.
Well, yeah, that was one of my attempts to restore my nervous system, was buying a Labrador puppy. He's now 4 months.
Amazing. Amazing.
There you go.
So anyway, so I was basically having these waves of fatigue that would hit me, 6, 7, 8 times a day. And when these waves of fatigue would hit me, I was basically it felt like oxygen debt. The way my body was yawning, and it was like these vicious kind of, I call them like fish slap yawns, like being slapped in the face with a fish. Like there's nothing you can do about it. Really violent yawns. But yet I was not short of oxygen. There's nothing I was doing that, would have caused any kind of problem. And it struck me when I was on a panel earlier this week that they were saying, one of the docs in New York was saying that they were looking at various different markers with the patients they were looking at that were dysautonomic. And one of them was end-tidal CO2. So that's basically the amount of CO2 in your system. And all of the people in their sample were strangely low, basically, much lower than they should be. And what this basically means is that the breath is then not working correctly, and your autonomic system that should be controlling your breathing is actually doing a really bad job of it. And it struck me, well, maybe that's what's going on here. Maybe I don't even realize what's going on with my own breathing. So I looked at a couple of exercises. So sort of in for 4, out for 6, and then some box breathing, which I think is called pranayama as well, where you go in for 4, hold for 4, out for 4, hold for 4. And I've been doing those sort of maybe 3 or 4 times a day for 5 minutes to go this week. And it's the first week I have not had the brutal fatigue hit me. So it is working, reprogramming at some level. So I would recommend, if you are having anything like what I've experienced in terms of the manifestation of fatigue, try a bit of that breath work, sort of a few, maybe 3 or 4 5-minute times in the day, and you may find it really helps, because it's weirdly helped me and I wasn't expecting it to, but I thought it was worth a pop.
Yeah, I mean, that's what they're doing at the Cleveland Clinic and Mount Sinai. That was one of the first things that came out was breath work. And actually, before COVID, I've become fascinated in breath work because I spent a week with Wim Hof. Do you know him?
Is he the cold water guy?
Yeah, exactly. So a couple of years ago, I spent a week with him, and in Spain, and also, started working with a guy called the Breath Guy, who's quite famous now because he's written a book. So I've become very aware of the power of the breath to modify our nervous system, which is, our sense of groundedness, connectedness, etc., parasympathetic function. So I tapped into quite a lot of that when I had COVID. But initially, it was very hard to do. Like if you were to try with acute pneumonitis to do the box breathing, you would fail.
Yeah,
exactly. So I think, but retraining the breath, and I've been through all the tests. I've done, respiratory function tests, and that was the main thing that came through. And many of the people listening today with long COVID might feel the same. You feel you can take a breath in, but the out breath is really quite impaired. So I think actually training your body to slow the out breath is the bit where the vagus kicks in, where the parasympathetic kicks in. So that's the 4, and then the maybe the longer 6. And breathing out through the mouth is really helpful, because if we breathe out through our nose, if you breathe out through the mouth, which they do in pranayama often, that really helps you slow it down. So I really recommend that. Richie has an app, a breathwork app called Flourish, which has been really, and he did a lot of Instagram lives throughout the whole COVID pandemic, helped a lot of people. So really recommend that I'm very interested that it's improved your yawning, because that kind of air hunger can be many things. Can also be hypoglycemia as well. You can also be, your blood sugar can be fluctuating. Yeah.
Which is also possible. I mean, who knows? And actually, you mentioned something there, which I'm just going to ask about, because one of my best friends is really into cold water swimming, and he's been trying to persuade me to go and do it and jump into Hampstead Ponds. And I'm like, nah. But I do think there might be something to it. I don't know what your take on that would be as a sort of a reprogramming sort of, activity for the body. Would you say it's a good idea, worth trying?
I go back and forth on this a little bit, because I'm a big fan of that. And when I was in Devon with this, I did go and swim and I actually think I was better then than I, have been in the months when I wasn't there, because I was swimming in the water. But I think, you need to gradually do these things. If you go and just jump in, you're going to give a hell of a shock to your system. And, cold water exposure is a stressor. You strengthen and become calmer as a result, because it's that process of hormesis, right? But I just don't know how well recovered we are in order to stress ourselves that much. But
that's my worry. Is the process of doing it going to actually getting over there, doing it, warming myself up again, coming home again? Is that just going to wreck me for the day? So maybe cold showers. I don't know.
It's all these things. No, exactly. I do like a cold shower, but there's something about the immersion. Like I've also been doing, because the centre where I work in London has a cryotherapy, and I've done that a few times. And, it definitely helps with the joint aches and pains, and sort of that clear-headedness going in a minus 180 chamber for 3 minutes. But, it's not achievable for most. But definitely a cold bath, cold shower. But, start with just 30 seconds. Don't try and, the whole idea is that you breathe through it. You're calm through the process. You're not agitated by it.
Yeah.
So, yeah.
So moving on to the next sort of treatment on my list, which is hyperbaric oxygen therapy. Could you tell us a little bit about that and about the possible benefits?
Yes. So how did I come across hyperbaric? Oh, yeah, I came across it coincidentally because there was an article published by an Israeli researcher called Shafri Ahmed or something, I think, which showed that hyperbaric exposure, which is a chamber, which is most frequently known for diving injuries, so preventing the bends, etc. They put people in a pressurized oxygen container, but it's used in America for all sorts of wound recovery, traumatic brain injury, sometimes cancer therapies, all of those things. But I became interested in it because this study had shown that it essentially was slowing down the rate of aging. They took a group of people, put them in a chamber, quite a lot. It was literally 3 months, 3 days a week, 90 minutes. But their telomere, which is a marker of how our cells are aging, one of the markers, the extension of them was extraordinary. It was 25%, which they'd never seen anything like. So it stirred up the longevity community. So I thought, right, I'm going to look into this a bit more. Found a centre in London, went to this centre, and then the lady who was running it said, we've been having quite a few people come with long COVID, and they feel so much better. So I started experimenting with it, and I remember the first time I went there, the next day I came out and thought, I can run. The next morning I got up and I could go for a run. It was quite extraordinary. And the sleep, it really, really helped my sleep. So how it can work, I mean, I think one of the theories is that you're essentially pushing oxygen into the mitochondria, or you're bypassing the mitochondrial oxygen production pathway, which the mitochondria, powerhouse of the cell, boring way of explaining it, take the fuels from our food, produce energy. In post-viral syndromes, if this is a post-viral syndrome, or any post-infective state, the mitochondria don't work very well. So it's one of the reasons we get so fatigued. We produce toxins, for want of a better word, from exercise at a much higher rate than we would do normally. And that can cause, a lot of the symptoms to experience, the joint aches, the pains, the brain fog, etc. So one of the theories with hyperbaric is that it gives us oxygen. But, we don't have the research on it yet. This is what we need. It's an expensive process. You can hire one at home, which is what I have done. And it's still around sort of £600 a month to hire a chamber. But do you know what I've noticed talking about parasympathetic nervous system and dysautonomia? Measuring that is interesting, right? So if you go for a medical assessment, and they like I did with Dr. Paul Glynn, and he was the first person to tell me I had dysautonomia. It's the lying to standing blood pressure and heart rate that they use as a marker of dysautonomia, right? So your heart rate and blood pressure can skyrocket after standing. Another measure of it is something called heart rate variability. I don't think I've heard you talk about heart rate variability before.
I haven't done.
No. Okay. So heart rate variability is something that some devices, like what I use is the Aura Ring, but other devices like the Fitbit or the Apple Watch, if you activate the Breath app, will measure a heart rate variability. And that is essentially a measure of parasympathetic versus sympathetic nervous system function. The higher your heart rate variability, the higher the activity of your parasympathetic nervous system. Now, I have noted, and a few other people as well that wear these rings, if you go and do a relaxation session in the hyperbaric chamber, your heart rate variability, all things equal, if you were just lying on a bed doing the same, is substantially higher, like 30% higher. So it somehow puts you into that parasympathetic state as well. I think that potentially because it's pressurized as well, it's like it makes you feel heavy when you're in there, like a comfort blanket. But I thought that was very interesting. And it certainly has led me to think, I feel like I'm shedding a skin slightly, if you know what I mean.
So how frequently do you use it? And do you think it's still giving you benefit? Well,
I do. But, again, I don't. Even though I've got one at home, I'm not at home all the time. I'm still running, a clinic and buzzing and doing various other things. But, theoretically, you should do 2 sessions a day, 45 minutes twice a day or an hour and a half. And you can use your phone in there. You can, talk on the phone. And I've taken Zoom calls from there before. And people think it's quite interesting. But, that's what my life has become. Like sometimes it's like, right, I need to use this hour to do this. And if it coincides, recovery is so important. And so hyperbaric and the other thing we'll come to, infrared, have really noticeably helped. Yes, I still can't really exercise with any intensity, but I can live a more normal life. My brain functions well most of the time. So I think it's definitely helped that on that aspect.
So moving on to, we'll cover infrared and then intermittent fasting after that, and then we'll take a bunch of questions. So could you tell me a little bit about how the infrared therapy works?
So I've been a big sauna fan for years. I remember reading Dr. Rhonda Patrick's work. I don't know if you know her. She's a PhD longevity and wellness sort of guru and researcher.
Familiar.
Yeah, I'm surprised she hasn't done anything on long COVID yet, because she does a lot of work on nutrition and omega-3. She's definitely talked a lot about the role of vitamin D and all of those kinds of things, and C, etc. in COVID, but not specifically about long COVID yet. But anyway, she was talking about sauna therapy. I met her a few years ago. So I'd been saunaing quite often when the gyms were open, etc., and noticing a massive impact on sort of, subjective well-being. And it increases. So saunaing, this is just normal saunaing, taking the infrared out for a second, is a proxy for exercise because it gets your heart rate up, it stimulates a cardiovascular response. So when I say a proxy, it means you're not actually moving your muscles, but you're getting similar benefits. Cardiovascular system, brain, endorphin production, BDNF, which is an anti-inflammatory molecule produced in the brain. Sauna therapy is known to do all those things. So fast forward into COVID and also improve inflammation levels over time through that same process actually as cold through hormesis. Infrared has different wavelengths of light that, not unlike the standard sauna, it's not just external heat, it sort of heats you from the inside, but the rays of the red light rays penetrate the skin and apparently have an impact on those same organelles, the mitochondria. So what I noticed as a difference between an infrared sauna and normal sauna is that you get a notable change in your mood. And this has been shown in the research too. You get a real uptick in endorphin and beta and I can't remember the other things, but production of these happy hormones in your brain.
Maybe. Yeah.
Sadly not dopamine, but it is related molecules. It's sort of the beta endorphin molecules, those kind of things. But So you get that, but also it seems to have a benefit on the skin, on collagen production, etc., etc. So, and you also sweat, which is clearly a good way to, cleanse yourself, get rid of environmental pollutants, etc. So I was using just a pop-up one, like a 200 quid one I got on Amazon at the start of, I just felt it just was really good for me. And, many people have used it and felt the same. And I was just taking a seat out, sitting on the floor in this pop-up, like boil in the bag thing, and staying in there for, 20, 30 minutes. And when I was at the throes of the dysautonomia, it wasn't good. I'd come out and feel really like I was going to pass out. But slowly that got better. I was also chucking a lot of electrolytes down my neck at the same time, which definitely do help dysautonomia, because they have an impact on your stability of your blood pressure. So yeah, infrared sauna is a good thing, relatively cheap, available through the pop-up ones or these sauna blankets people might have seen. Don't overdo it, especially if you've got dysautonomia, but they do increase, because you get a lot of stiffness, a lot of fibromyalgia with long COVID. So I think it can really help with that. It's not as stressful as having a hot bath, because I don't know if you're about you, but you have a hot bath, it can really send your heart rate sky high.
Well, yeah, so I do tend to have a bath last thing before bed most nights, just because I feel like it calms me down. But there have been times when the bath's been a bit too hot, or I've been there a bit too long, and I've got out of the bath and felt quite unwell. So yeah, you tread with caution on that front. So moving on to sort of our final topic, which is, it's got almost like a sort of a bit of a cult-like following inside the long COVID community, and this is intermittent fasting or slash autophagy. Could you just tell us a little bit about the theories behind why this might work, and just describe a little bit about why this might be a good idea.
So why is it good? I guess this became a bit more famous since Gwyneth wrote about it. But it's been, as in Gwyneth Paltrow, but it's been known to be helpful in the functional medicine. Yes, because it increases what so when we talk about intermittent fasting, we mean there's a period during the day that you don't eat, which gives your body a chance to kind of reset, clear out. It gives your gut lining a chance to sort of reestablish itself, reduce inflammation, etc. And it has been known to stimulate something called cellular autophagy, which basically means getting rid of dead cells, a sort of cellular clean out. There's such an array of intermittent fasting methods, right? You can have time restricted feeding, which is basically eating all your calories in a 12-hour window, which is probably recommended. Some people shorten that window to eating it within 8 hours. But I think there's a consensus now that giving yourself a 12-hour window overnight where you're not eating or not having any caloric consumption is a good thing. My concern with extended periods of fasting is that it's stressful, right? If you, depending on your fat, like how much fat stores you have, etc. But fasting is stressful because it raises your stress hormone levels, cortisol, adrenaline, etc. Unless you're able to, be in a German spa where you're just massaged all day and the whole process is really cleansing and lovely. But if you're trying to live any degree of normal life with kids, dog, work, etc., you're fasting, you feel hungry, that's going to agitate your system. So I tell people intermittent fasting is good. Probably having a period where you don't overload the gut, okay? Because we all know that a cleaner form of diet when you're trying to recover from illness is only going to be helpful. And that's talking about, healthy fats, low refined carbohydrate intake, no added sugars, all of those sorts of things. But you've got to bear in mind as well that you've got to have enough protein. You've got to have a sufficient amount of carbohydrate to keep energy intake and your brain function up. So it's a complex picture. No wonder people are a bit confused, and especially when you add in the sort of histamine aspect of things, and people go, "What can I eat?" But I think you have to get to know when you're hungry. I think learning when you're hungry, having a period overnight, at least 12 hours where you're not eating, but you can have, water or non-caffeinated herbal teas is a good thing. But if you want a bigger meal at breakfast, that's good. If you want a bigger meal at dinner, that's also good. But just notice when you're hungry as well and when those meal timings suit you. Does that make sense?
Absolutely, yeah. And I think there was a school of thought, in one Facebook group that not by fasting, basically you were, inverted commas, starving the virus that was in your gut. I'm not sure that really holds up under much scrutiny. But for whatever reason, a bunch of the people who were doing this seems to feel better whilst they were doing it, so it may be working in other ways.
Well, I also didn't mention, actually, which is something I am a fan of, is that if you are fasting, you are probably going into ketosis, which is when your body produces breakdown of fat, which is our ketones. And ketone bodies have an impact on the brain, on your mood, on modifying inflammation in the body. So some people feel good on a ketogenic diet, and that might be a side effect of the fasting, which is why people feel good as well. I do sort of ketosis and intermittent fasting quite frequently, more specifically in the day, especially if I've got a busy day. I will, be in ketosis, which is essentially fat burning most of the day, and then I'll have carbohydrates in the evening. So, there is some evidence that can be good for the brain and for inflammation generally. But they are two separate things that people don't often, don't tease apart, but they are important to differentiate.
Yes. Do you need to go and get the door?
I don't know why. Hang on a second, sorry.
It's all right.
Hi.
Busy lifestyle.
Sorry, did he just run out? Thank you, Simon. Oh, escaping dog. Sorry.
No,
back.
Brilliant. Yeah. What's the little pup's name?
Leo.
I don't know if anybody else has been watching Olive and Mabel. I've just recently found Andrew Cotter's YouTube channel with his two Labradors, and it's just such a world of joy. It really is.
It's definitely been helpful. They are really, they just take you. You know how we can get depressed and really in our own heads, like, is this ever going to get better? And then you're like, you know what? I'm just going to look at them for a while, and they, go through their life and. It definitely grounds you a bit.
Well, there's also something where when you stroke a dog, both of you get, I think, is it an endorphin kick? Both of you get some kind of chemical release when you stroke a dog. It is, shown to be beneficial for health.
Yeah.
Oxytocin, there we go, yeah.
Which, if you're not in a relationship or getting, or got kids that, hug you every day is a good thing.
Yeah, indeed. Right, we've got 7 questions. Let's start trying to address some of them.
Sure.
Oh, I can choose now. Oh, that's new. That's a new function. Right, let's choose one from Owen Maxwell.
How you doing, guys? Cheers for all the work, as usual. Hold on, how do I swipe to cancel?
Nope. It's too late, Owen. Didn't cancel. Let's try again.
Hello, guys. So, quick one. I had a virus, looked like COVID, all the symptoms last year, around about March. And all the usual symptoms of long COVID, particularly fatigue. It's really stopped me doing everything in life. But I actually got a stool test done after listening to the last stereo and came back with high candida levels. And I looked into it, and obviously that can happen from a compromised immune system. And I'm just wondering, do you think it's possible that the candida could actually be the main cause of the fatigue? Let me know.
Very interesting.
Do you like me to take that?
Yes, please.
I thought you were going to have a stab at the candida.
No, I'm not having a stab at that one, no.
So I should probably state from the outset that doing any gut test, candida is very frequent finding in many of these gut tests, and candida is very common. It's an opportunistic yeast. It's found in the gut very frequently. So in this whole era of, improving your gut health and immune health, having too much candida in the gut is certainly going to be having an impact on, most likely is having an impact on your immune function. It's just whether it's a cause or consequence. So what can you do about it? So one, you can remove Candida feeding foods. I just sound a bit I don't know. So things like, refined sugars, etc. All of that will feed Candida in the gut. You can go on it. So you can go on an anti-Candida diet. You can take anti-Candida supplements. There are many different teas, etc. Googling will tell you that. Or you can you can go on a medical regime for 3 days of fluconazole and over-the-counter anti-yeast. But it's only, in my experience, it's only one small part of the fatigue puzzle. Yeah.
Yeah. Okay. We'll take another question. This is from Julie.
Any help for tinnitus?
Yeah. So it's a good question. And tinnitus is very common in long COVID. I have no idea on this one.
I have had tinnitus as well, and I think it's got a multifactorial origin, but I think stress is one big one, because the autonomic stress, that sympathetic nervous system, so adrenaline, and two, histamine. Like, there is no doubt that when I went on triple therapy and improved my histamine, that it got better. So please try antihistamines. Breath work, cranial osteopathy, also can really help, because it can cause some adjustments around the base of the brain that can improve tinnitus. It also improves autonomic functioning. So yeah, those would be my two things on those, on histamine.
Okay, I don't know if I've got some text on this question. I'm just going to see if it's the same text as is read out or not.
Hey, so I'm about 7 months in, and the only remaining symptom I really have still is the nagging chest pain. And I was curious, if I stick to a very strict diet, very low histamine, and, very low amount of exercise, I can pretty much manage my symptoms and not feel awful. But just how long, do we have any idea of how long this will go on for? Where is this a lifelong thing where I just continually have to manage what I eat and limit my exercise? Or, do we have an idea of how much longer, staying on a vitamin stack and really heavily limiting, my life? Just kind of curious if there's an end in sight or not. Thank you.
Well, I mean, I'll just say one thing on this, which is that it seems like the best thing we can do is to look at other vaguely comparable viral illnesses and the people who suffer long-term symptoms after that, what happens. The results are mixed, and they're not necessarily always that comparable. I don't know what you would say to that, Tamsin.
Yeah, unfortunately, we don't know, and we all need a ray of hope right now. I think patience is key. I do think month on month there's a gradual trajectory to improvement for most people. I am, quite intrigued by the vaccine data and how that is improving symptoms for many people, although it's not a cure for sure, that we thought it was, or some people said it was initially. But I do think that we are going to gradually grow out of this. But I think we really need to invest time in improving our systemic health as much as we can during this time to prevent it becoming chronic. That is my impression so far.
Yeah, and and sort of the lessons from the ME/CFS community, a lot of those people felt like overdoing it in terms of exercise or activity or stress at whatever point early in their sort of post-viral experience is they feel that maybe contributed to it becoming more of a chronic condition that, ceased improving. So I think, if there is one lesson to learn from that community, it is to take that lesson, which is really try and don't, if you experience any post-exertional malaise, you back off. Don't try and push through it. It's a warning, and try and look after yourselves. And if you can manage to get by in a state of no, post-exertional malaise, then I think you're giving yourself the best opportunity to recover. That's probably what I would say there.
Yeah, I totally agree. I think although it's very, there are people that have been lucky and have pulled through and don't have long COVID. So, there's something in the genetics as well. And I don't know if you've done the histamine-related genetics or methylation genetics or anything like that. But, I've certainly got a whole stack of dodgy genetics, as it can probably relate to inflammation and histamine, and therefore I'm more likely to suffer with these effects. If you look at your parents, for example, are they more prone to arthritis, to asthma, to inflammatory, other inflammatory conditions, autoimmune conditions? Then you're more likely to develop problems from long COVID. So, or the sequelae of long COVID.
Let's try with
Hi
Tom.
guys, my question is, I've tried intermittent fasting. However, when it gets towards like 1 p.m., right, I start getting like tired and like start feeling faint. So is there is that a good thing, or is there a way
No,
around
I don't think so. That's low blood sugar.
to that solution?
Yeah, I'll let
Thanks.
Tamsin answer that.
I couldn't hear exactly what did he say exactly at the start?
He was saying that he was feeling, by the time he tries intermittent fasting, but by the time he gets to 1 o'clock, he starts feeling faint and not very well. And my feeling would be that he's basically running on low blood sugar at that point, and possibly a touch hypoglycemic, and that may not be doing him any good if he doesn't have the fat reserves to, So anyway, I'll let you answer that.
Yeah, I totally agree. And it sounds like that. Look, the last thing we want is to make it more stressful for people. And I think, you don't really want to be in a overall calorically depleted state, which means that when you are eating, you need to have enough calories in those windows to sustain weight and protein, etc. So if you're feeling like that, then, one, electrolytes are important. But some people feel a lot better if they have electrolytes in the morning. And that can be, just simple diurolite, or I use something called electrolyte synergy from Designs for Health, which has got some mitochondrial cofactors in it, like D-ribose, etc., which has been really helpful. So, yeah, I definitely think you need to look at, if you're feeling like that, you don't need to add another symptom to your long COVID box. Then please eat then, and then if you want to fast overnight for 12 to 16 hours, that's fine, but don't put more pressure on yourself, for sure.
Okay, so some of these questions, actually, amazingly, the new version of this app appears to actually give me text for some of them, so I can actually choose them. I've got Andy Duke asking if anybody gets a hot metallic taste in the breath. Thanks. Might that be ketosis, perhaps, or something else? Because other people did mention this in acute COVID, that taste obviously changes.
Yeah, metallic taste is more a side effect of the COVID illness itself for some bizarre reason. It seems to affect the nerve cells that transmit taste to the brain. But ketosis is more of a sort of a sweet, petrol-y type taste. Yeah. So,
okay, sorry. I was just about to put another question.
Metallic taste is quite common. Yeah, for sure. And it does.
You mentioned.
So sorry, I just interrupted you, Tamsin. What were you saying?
No, you started. I just said that it tends to improve over time.
Okay.
If you sort of taste test you stimulate your taste with all the things that are not allowed on a histamine-free diet, like coffee and limes and lemons and stuff.
Yeah, it's the 6 of one, half a dozen of the other. You've got to, damned if you do, damned if you don't. Here's a question on MCAS, actually.
Okay.
Oh, it won't actually. Okay, so I can't play this question now because I pressed it once, but I've got a text thing. So this is from Abigail, and she says, you mentioned antihistamines. Could you potentially talk through what your regime is, and also a bit about MCAS theory and your thoughts on that? Thank you.
Yes, I can. So I think I alluded to personally that I noticed that some of my symptoms anecdotally improved when I took chlorpheniramine, which is Piriton, and that was quite early on in the illness. I was getting like rashes and just reacting to things and blood pressure fluctuations. And chlorpheniramine was the only antihistamine I had at that time, and that was definitely helping. But I didn't really know why, and it wasn't until I met Paul Glynn, who works at UCL. He said that they were investigating this kind of mast cell activation syndrome and phenotype in certain people with long COVID. And so he did some tests, and he said then to go on this regime of a prescription. And I should say at that time I got really bad. I was having like a lot of facial swelling. So waking up and my eyes were like super puffy. My hands, my joints were really like I was retaining a lot of fluid, those kinds of things. So the antihistamine therapy did help, but it's a big dose. You're taking an antihistamine, an H1 blocker twice a day, and then an H2 blocker like famotidine, Pepsid twice a day, and then a mast cell stabilizer at night, which I do take, and I think it does help, something called ketofen, but it makes you super drowsy, and it takes it can knock your mood and make you feel a bit low the next day. So yeah, I do think that it plays a role in a lot of people. But ask yourself, are you one of those people with mast cell symptoms like, facial swelling, puffiness, rashes, watery eyes, allergies, hay fever, irritable bowel syndrome? Are you that now? And were you more prone to that pre-COVID? Did you have any of those symptoms? And or sinus problems? If the answer to any of those questions is yes, then you may benefit from the antihistamine approach. And I'm telling you now, it's not just going to Boots and buying, Piriton over the counter. Prescription antihistamines and a mast cell stabilizer, you really need to hit it on all fronts to notice a difference, in my opinion.
Yes, agreed. Right, here we go.
Hi, second question. Regarding recording means. Oh, sorry, I'm really bad at using this. I do apologise. I thought it wasn't started. Yeah, regarding the infrared saunas, I actually bought one of these myself. I found it was quite hard to deal with the fatigue, but more concerning, I've got a portable infrared sauna, and I've read that the ETF levels, basically the electromagnetic fields, can be quite unhealthy, and there's some sort of controversy regarding that if you don't use a high-grade infrared sauna. Do you know much about that? Am I overthinking it, or is portable infrared saunas suitable as far as you're aware?
I mean, you've got a point. I think there can be a quality issue with some of them. So I wouldn't just buy the cheapest one. I used Firzone, Firzone. I don't have any affiliate relationship with them or anything, but they are high-quality carbon heaters. I now have a more Rolls-Royce version, given that I spend so much time in it, and I take my laptop in there and I do my calls from there, because I, sometimes spend up to an hour in there at a lower heat now, and because it makes me feel good. So I have a Sunlighten, which are, amazing, very high quality, very low EMF. So I think it's worth, getting a quality one, not just buying the cheapest available, for sure.
Do you have another 10 minutes or so, Tamsin? We've got a bunch of questions, and I'd like to get through them if possible. I know it only sort of schedules an hour, but I just thought I'd ask if that's all right.
Yes, sure.
Yeah, okay, let's see.
Go
Let's
for it.
fire a few of these away.
If you have the vaccine, can you still get COVID?
Well, the answer to that is yes, you can still get COVID. You appear to have 100% protection in the data we have so far from severe disease that might hospitalize you, but there is still a chance of getting symptomatic COVID. What we don't know is what the risks of getting long COVID are. If you've been vaccinated, you never previously had COVID. You would hope that the antibody protection and the stopping the virus going too wild in those early stages would reduce the chances of developing long COVID, but we just don't know. I don't know if you have anything to add to that, Tamsin.
I think the what we're seeing is that the rates of COVID infection are going down dramatically thanks to vaccination. So I do think that it is working as a population strategy. But I do not think, I think it's very unlikely if you have a vaccine and you're not on immunosuppressants, steroid inhalers are an immunosuppressant as well, and I do think they can modify the immune response. Then three to 4 weeks later, I think it's very low chance of you getting COVID. And I think
yes, go on, sorry.
And I think if you've had it before, then you're vaccinated. I mean, I've seen what's happened to my antibody levels since having the vaccine, and as I shared with you, and it's astonishing the number of antibodies you get compared to the antibodies you get from the virus alone. So these are very effective. They're very effective injections, as far as I can see, in the majority of people. And yes, they do have side effects in some, which need to be addressed too.
Right, we'll go again. I've got Julie.
How long do you have to fast for your body to go into ketosis?
I guess it depends on how much you've eaten before you start fasting.
Yes, it does depend on that. It definitely depends on how much, how much stores of carbohydrate you've got in your liver and your liver and your muscles. But it's generally 12. So generally, if you've got, after 12 hours, you probably will be producing some ketones. I mean, it's worth it. If you're interested in this thing, you can get a cheap monitor, a ketone monitor like Freestyle on Amazon. You can do a finger prick blood test and see what your ketone levels are. But, not everyone can burn fat and therefore produce ketones at the same rate. It's quite different from person to person. To be honest, but you can become ketogenic or in ketosis and eat, but you just have to avoid carbohydrate. So I think that's important. You can be on a ketogenic diet, which is largely high fat, moderate protein or moderate to low protein, low carbohydrate, and still be in ketosis. But again, I wouldn't do that on your own. I think people need guidance if they've never done that before, because I think there's a lot of pitfalls and it can make you feel worse rather than better. And this is not a time for being stressed. I think, luxury aside, there are health resorts like the Mayo Clinic or the Buchinger Clinic, these German places that do fasting therapies that look after you through this process. But, if you do want to do a fast, then make sure you have electrolytes, that you're very relaxed for the day. You just do very low, mild walking exercise, and that's it. Hope that answers it.
Here we go. Got a question on chest pain.
Do we have any theories on what is causing the chest pain that so many folks are having? I know several of us in the long COVID forums have gone to cardiologists and doctors, and everything comes back clear and clean. But we're obviously feeling something. Is there any idea of what is causing that? Is it just part of the MCAS, or just interested to know your thoughts?
The joy of being told everything's normal on a blood test.
Yeah,
you probably had that too. If you look deep enough, there's always slightly a few red flags. But it is related to cytokines, these inflammatory markers that aren't, and histamines, which aren't measured in a standard blood test. I've been in talks, as I know you have, in terms of research. There's a company called Chronomics who have started to do an inflammaging test, which is an epigenetics test, which is basically looking at DNA methylation. So looking at certain inflammatory genes are turned on, and also looking at these cytokine panel in the blood. So I'll be very interested to see what their data comes out with. So yeah, unfortunately, aside from, it might be helpful to get an autoimmune panel done, looking at total autoantibodies. That might be interesting and relevant for some people. Some people can have a rise in the more standard blood biomarkers of inflammation, like C-reactive protein and ESR, or a low globulin, which is a marker of immune function. But, if you dig a bit deeper, you do look at, and I've had all sorts of tests done on my, immune cells and immunophenotyping, they call it. So there's definitely a T cell malfunctioning, and your mast cells become trigger happy. So they release a ton of histamine in response to a trigger. And that's why stabilizing them can help symptoms. And stabilizing, I say, through, diet and the supplements, because I've mentioned diet, supplements, and also the triple therapy.
I've got one from Felix here.
Hi, Jez, big fan. Thanks so much for this. B3 helped me. I had COVID a year ago, and B3 really, really solved the cognitive issues. My lasting problem, though, is inflammation in my chest. Like my ribs, I think it's just stuck in there, and I can't seem to do anything to get rid of it. And that inflammation, when it flares up and gets worse, the pain I don't mind so much. It's more it affects my breathing, and I can't lie down and sleep and stuff. And from what I've heard, it's costochondritis. And I was wondering if there's a common, treatment for this, because I can't really seem to find anything.
I'll let you deal with that, Tamsin.
It's interesting that you've got quite localized inflammation if it is costochondritis. I don't know. I mean, other people tend to have other, joint aches and pains. But again, I really think infrared sauna helps with those kind of things. An anti-inflammatory approach. I really like Flarin, which is a liposomal form of ibuprofen that you can buy in Boots or any pharmacy. It's very, it doesn't upset the gut. Quercetin, you've covered that before, can really help inflammation. Maybe liposomal turmeric, curcumin. High intake of omega-3s. You need like a gram of EPA a day, which is quite significant. And maybe again looking at other alternative measures like acupuncture and cranial osteopathy, etc. Maybe yoga to increase the lymph flow through there. But that would be my recommendations.
I've got one from Kelly here.
Hi. You said quite a large amount of antihistamine. I'm currently taking fexofenadine 120 milligrams a day, with also Famidin as well. Would you suggest taking the upper limit of 180 of the fexofenadin? Because I've been on this some time now and it's still really not taking effect fully that I need.
So amazingly, I can answer this because I'm on fexofenadine. I take 2 times 180 a day on that, and that's only half the maximum dose. So unless Tamsin wants to correct me, I believe you probably could go up.
Yeah, you can absolutely go up. I mean, it depends what the effect that you need, I guess, because, I've actually come down to like 120 once a day because I've increased my mast cell stabilizer at night. And I think that sometimes you just have to adjust for you, because if you take too much antihistamine, you can end up feeling quite, flat, or, it just depends on you if you're having what kind of histamine symptoms you're having. So I would say absolutely go up, ask for a higher dose and kind of play around with it. But if you notice that it's maybe dropping your mood a bit, etc., then you have to kind of weigh it up.
Okay, we'll do 2 more questions, and I'm sorry we couldn't get through everybody, but we'll play one from Joseph here.
Hi guys, I was just wondering about the role of prolonged fasting. I actually tried prolonged fast for about 4 days and it seemed to improve my symptoms. It relieved some of the fatigue and a bit of tolerance towards histamine.
Oh, I mean, 4 days is hardcore. Credit to you on that one. I wouldn't fancy that. I'm starving after about 4 hours after my last meal. So, I don't know what the biology is on that though.
I missed the first bit. What did he say?
Oh, so he was saying that he's what was your opinion was on prolonged fasting. He'd tried fasting for 4 days and found that by the end of it he was feeling slightly better, and the histamine response was also improved, he felt.
I mean, all of these things, yes. It's just how long is that effect maintained? If we give the body a complete chance to say, right, I'm not going to take anything in, but then are you just down-regulating all of your systems to be able to deal with any histamine in the future? And then when you do introduce, food, anything, then you're just going to react to it. So, I don't have a problem with people doing prolonged fasts. I worry a little bit about these long 4, 5, 7 day fasts that people are doing, because I do think they can be stressful if maintained, if repeated. and put you into a sort of catabolic breaking down state. I don't know about you, but I've lost a lot of muscle already. If I was to go on a 7-day fast, I wouldn't look. Anyway, 4-day. But I think you've got to just weigh it up. I just don't think extremes are good for long COVID, is my opinion, to be honest. I think a bit of intermittent fasting, a bit of resting the gut, a bit of activities that you enjoy. So that's my warning. So don't get obsessed with feeling the benefits of fasting, because you do become high from the ketones. That's why some people with anorexia can fast for so long, because the ketones that you produce and those sort of glucocorticoids, which are are stress hormones, are actually anti-inflammatory. They're like cortisone, right? We produce them, but they have some benefits, but they also can suppress your immune system. So yeah, I think in two ways about this. But you've got to learn to, what feels good to you. If this is feeling inherently wrong and stressful and you don't want to do it again, then it's probably not a good thing.
Indeed. I'm going to play one from Charlie here.
What's the best way to differentiate whether we're dealing with something like ME/CFS or dysautonomia? Both conditions can manifest in fatigue. Both conditions can manifest in crashing after activity. However, with dysautonomia, POTS, or the static hypotension, that's necessary for the first couple of months to get to a manageable state, where with ME/CFS, my understanding is you need to totally hold off the wheel. And so I do have a concern of whether am I not, getting myself to a point where I can get my dysautonomia under control because I'm not doing enough, or am I doing just a little too much where I'm not giving my body time to rest? And I feel like a lot of long haulers are in this limbo area, whether they're not sure whether they're manifesting in a form of dysautonomia or ME/CFS.
Yeah. I don't think there's any maths on this. I don't think we can look X plus Y equals Z on this. I don't know how you'd respond to that, Tamsin.
I feel the same, sadly. I don't even think we know what ME or CFS is. And I think, it's sort of, we've got a tick box of all of these vague symptoms that people have, but I don't really think we understand all the mechanisms and drivers. And I think, as people have pointed out, the amount of research and time and money that's going into long COVID, I think we will be able to find out and therefore help those with CFS ME. But, I don't know about you, but some days I feel very CFS ME, but then other days I feel completely not. And that isn't characteristic of, people who are characterized as CFS, that, it's more persistent. You have this malaise and fatigue and all of these symptoms. But so I would try and not label yourself too much. I would try and learn to recognize what you did on the good days, or recognize on the good weeks, what has been building you to feel better, and to manage symptoms appropriately, and whether that's more rest. Okay, let's just take it back a sec. I fundamentally think that intense exercise is a terrible idea for long COVID. I definitely 100% think that it's triggering cytokines, it's triggering the cell danger response that we talked about at the start. So I think all exercise needs to be restorative in nature. I don't know how long that's going to be for. I think you can feel it in yourself. If you feel up for doing some strength work and don't crash, with a few days afterwards, I think that might be okay. But I think at least, for a long period, it needs to be more restorative exercise. And that's, walking in nature, maybe swimming when we can, as I do. I just do some like yoga and some stretching, etc. So I would try not and label yourself yet, as I said, and try and just, keep listening to research as it comes out. And, I know, Judge, you're really sharing a lot of information, and I will be too. So, yeah, we're not there yet, but we have learned. Look how much we've learned in such a short period of time in terms of science. So we will get there. Just stay positive. I did want to mention one thing that I really think is important is the serotonin aspect of things, because
I agreed.
Yeah, and I don't think it's been talked about much, because I think people who are going on, some kind of serotonergic support or antidepressant support are doing better than those that aren't. And that is because it seems to have an effect on the neuromuscular symptoms, which is the brain control of your muscles, your joints, inflammation, etc. I don't take something. I do take a very low dose of amitriptyline at night, literally 5 to 10 milligrams. And I was given that by Paul Glynn to help sleep. But I noticed that because it can increase your level of neurotransmitters, including dopamine and serotonin, I noticed that it buoys up a lot of my symptoms. So please don't be scared of going down the route of, it was very early on recommended to me to go on fluoxetine. I didn't, because I have a history of being on them for many years, and I didn't kind of want to go back there yet. But I do think supporting your mood, even if it's naturally through, 5-HTP, tyrosine can really support dopamine function. I think that is a key thing to look at. Not even just for mood and anxiety, but for its effect on the muscle and joint and post-exercise or post-exertional malaise symptoms.
And brain fog too. I think serotonin's kind of implicated too in a bunch of the neurological stuff. And it does seem that people who take SSRIs, and there is a bit of a stigma around them, and certainly in the past I was a bit like, I wouldn't ever want to, once you're on that road, you're on for ages, you've got to step down, it's difficult, blah, blah. But there's a lot of people who do respond very well to them with long COVID, because it does seem to be addressing something that is currently dysregulated in the body, and that sort of NAD plus sort of metabolic pathway is also implicated in serotonin as well. So yeah, that is something worth looking at, especially if you are struggling with insomnia and struggling with mood issues. I would definitely recommend talking to your GP about something to manage that serotonin, whether it's SSRI or otherwise. So I think that probably brings us to a close. Sorry if we haven't got through everyone's questions. Thank you so much for your time, Tamsin. I really appreciate it. I hope it doesn't give you too much cognitive pen.
Thank you. It's just good because everyone's got so many questions about it, because it's it's affecting so many, and there's not really that many resources available that are of any use.
Indeed.
Yeah.
Yeah, I'm actually just at the moment involved in being a PPI, so helping UCH developing an app called Living With, which is going to be designed as an app that helps clinicians treat people with long COVID, and people on COVID can use the app to help them with information. But it's so difficult, because what do you populate this app with? Because we don't actually know enough yet, and that's the struggle, right? They're sort of adapting what we know about other conditions and trying to make that applicable to long COVID, but it's only partially applicable in certain cases. It is really hard. We are all kind of sort of blundering through the dark on this, and occasionally sort of seeing a bit of light here and there to sort of shine some light on some part of it. But it's complicated, and it's different for everyone. And that's the other thing too, right? It's not like this is just one complicated condition that everybody suffers the same way. It's an incredibly sort of complex condition that manifests in 100 different ways, and different in one person from 1 hour to the next, let alone from one person to the next. So yeah, it really is a challenge at the best of times.
It is definitely.
Yeah.
So I just wanted to say that we have put together a long COVID support platform at Wellgevity, which we'll be building on, which is basically a series of videos that access to doctors like me, who can potentially help out with some of the antihistamine therapies, any further testing like we've mentioned, etc., and some guidance there. And that's just gone live. So yeah, so just check that out on wellgevity.com.
Okay, and that's all just on your website. It's fairly easy to navigate there, is it?
I think it's just wellgevity.com/COVID.
Okay. Long COVID recovery. I'm just having a look at the moment. Is that it? There's a long COVID recovery tab. Yeah. Okay. Perfect. So yes. So looks like there's lots of stuff there. So by all means, go and check that out. And thank you again, Tamsin. I will hopefully speak to you soon.
Take care, Jez. Nice to chat.
Cool. Thank you. You too. Bye bye.
Bye everyone. Bye.